Okay, I will be refuting the claim that consuming processed meat significantly threatens human health. My claim is that consuming processed meats do not increase a risk for human health. Processed meats differs from regular meats because processed meats are chemically altered to preserve better, look better, and taste better. Her secondary claims were 1, eating processed meats causes heart-related issues, and 2, eating processed meats causes cancer of the colon and rectum. So for the first secondary claim, Julian claimed that by eating more than 1 ounce of processed meats will greatly increase the chances for developing a heart disease. She uses the Harvard School of Public Health as her source. While that might sound nice, Harvard collected 20 different studies for their information, and there's no data that states that those studies are reliable. Also, the data states that for every day that someone has a serving of processed meats, there's an increase of 42% chance that they will be getting a heart disease. So within 3 days, there'll be over 100% chance of a heart disease. That doesn't seem right, or maybe it just wasn't stated clearly. If someone repeatedly eats one type of food, regardless of what it is, over time they will be less likely to be able to eat other nutritions that they need, resulting in becoming unhealthy anyway. Now for her subclaim, for her first secondary claim, was that an increase of salt causes a 23% increase of the chance of stroke and a 14% chance of an increase of a heart disease. Kuzma of Men's Health News reports that when researchers examined data from 7 studies, they found that people who lowered their salt intake were just as likely to have a heart attack or stroke as those who didn't cut down on their sodium. The review was published in the American Journal of Hypertension and tracked about 6,500 people for between 6 months and 6 years. This clearly proves that having a lot of salt doesn't necessarily mean that someone will develop a heart disease. Now for her second subclaim for her first secondary claim regarding heart-related issues is that vegans and vegetarians in a study had less TMAO levels and were therefore healthier. Chris Kresher, a practitioner of integrated medicine, wrote that if eating meat increases heart disease risk, we might expect lower rates in vegans and vegetarians. Early studies suggested that this was true, but better controlled studies suggested it's not. The early studies were poorly designed and subject to confounding factors, i.e. vegetarians tend to be more healthy conscious on average than the general population. Newer, higher quality studies that have attempted to control for these confounding factors haven't found any survival advantage in vegetarians. Her second secondary claim was that eating processed meats of 1 ounce 5 to 6 times a week for 10 years increases the risk of cancer by 50%. She got that fact from the American Cancer Society. The American Cancer Society is a volunteer organization and is therefore not a credible source compared to doctors. Also, there is no definitive data that proves that the processed meats are the cause for the cancer in the study. Now her subclaim for her second secondary claim was that nitrate and nitrite causes cancer. Colleen Doyle of cancer.org states that nitrite and nitrates are added to meats to preserve color and prevent spoilage. Unfortunately, these compounds can be converted to nitrazines, which are known to cause cancer in animals, though again, the link in people is unclear. Doyle even states that nitrazines might not affect humans, it only affects animals, and there have been no signs in human testing. And to sum everything up, 1, eating processed meats do not cause heart-related issues, and 2, eating processed meats do not cause cancer of the colon and rectum, proving that eating processed meats do not increase a risk for human health.
All right. Daniel, I think that you do pretty well with the rebuttal type evidence. The refutation claims a little bit inconsistency on. I think that there are some places where you're just going with a general statement that I don't think bears much scrutiny as a press on the evidence, and you need to find something a little bit more substantial. That's why I thought that your rebuttal evidence worked better. You have a pretty good setup of what the claims are, so organizationally it's not hard to follow. When you get to that first point, you challenge the Harvard study, and basically it's an aggregate study summarizing the 20 different studies that they looked at, and your criticism is, well, there's no evidence that says that this is a good study. The absence of evidence saying that it's a good study does not prove that it's a bad study, and you have no evidence to suggest that there's anything wrong with it, so you're going to have to go on the assumption that everybody here is going to have to disbelieve the Harvard Medical Group that conducted this survey of the 20 other studies, and that they're all idiots and wouldn't be able to see a flaw in those particular studies. I think that's kind of a weak press. That doesn't really help your argument very much. I think the argument that helped a little bit better was the way the advocate presented it suggested some misunderstanding of what the study's conclusions was, were. Let's get the tense right there. For instance, if it increases, 32% every day, well, that means in 3 days I got a 100% chance of getting this, and that seems to be what the advocate said in their argument. They've probably misread what the study actually said, and so that should be the argument, that the study has not been clearly explained to you, that if you accepted the premise that the advocate was presenting, then 3 pieces of bacon over the course of 3 days means you're going to have a heart attack, and you could probably look around and see a whole bunch of people who would all be dead, assuming that this statistic was accurate. So, I think even if you didn't have any counter evidence on that point, that then puts the onus back on them to defend that position. I thought that the salt issue was handled a little bit more effectively, because you just presented a rebuttal study that found that salt intake does not appear to have a significant relationship. You explained the significance of the study based on the number of years that it was conducted, the number of people that it has, and it didn't find a correlation in longevity. So that, I think, is a pretty good piece of rebuttal evidence on that point. On the next point, the second point, you label that we kind of talk about TMAO levels. And I'm not sure why that comes up as an issue, because you don't really follow up on it. Your follow-up has to do with these studies in the long run. That there was no survival advantage from the vegetarians or the vegans. And I thought that it also nicely explains that there is kind of a bias built into the studies to begin with, because vegetarians and vegans have other health issues that they tend to be more attentive to. And so the early studies that might have suggested such a relationship can be discounted by the more controlled studies. That gives the research that you're presenting a greater degree of credibility. That's the contrast, I think, that you want to make. On the the challenge that you make on the cancer argument is similar to the one you made up before. The American Cancer Society, that's a volunteer group, so we can't really trust them. They're not particularly credible. The American Cancer Society is a volunteer group, but most of the volunteers are, in fact, healthcare professionals, and it's not like it's 15 people, in a classroom who decided that they want to fight cancer. It's been around for a long time. They've spent a lot of money and do research. They've paid for a lot of research also, so that press is really weak. It's the kind of thing that you might say if you had just heard the argument, you had nothing in your holster that you could shoot at it and say, well, let me take a wild shot in the dark on this. There are probably better arguments on this. I thought, for instance, that your later evidence found that there was very little strength supporting this relationship as a result of the nitrates. That was a stronger piece of evidence. Like I said, the rebuttal argument was stronger. All right, thank you.